Can COVID is an open science collective dedicated to rapidly mobilizing and sharing knowledge to help inform Canada's COVID-19 response. To learn more about us or how to join our community, you can visit our website at cancovid.ca.
Okay, so I think we can get started. Hello, everyone, and welcome to this week's edition of Can COVID Speaker Series. Thank you all for joining us today. My name is Rosa Stalteri, and as many of you know, I lead the knowledge translation team here at Can COVID, and I'm also your moderator for today. And I do have the pleasure of introducing you to this week's speakers, Dr. Bukola Salami, who is the Director of Intersections of Gender Signature Area, also an associate professor at the Faculty of Nursing within the University of Alberta. She's also the founder and lead of Black Youth Mentorship Program, founder and lead of the African Child and Youth Migration Network, and also principal investigator at the Health and Immigration Policies and Practices Research Program. And we also have Dr. Janet Kemei, who is the postdoctoral fellow at the University of Alberta, also an assistant lecturer within the Faculty of Nursing at the University of Alberta, and a researcher within the Health and Immigration Policies and Practices Research Program. And our title for today is COVID-19 Disinformation and Misinformation Among Black Canadians. So just before we start the presentation, we did save time for a Q&A session for today. So we do encourage you to enter in your questions into the chat box, and then I'll be happy to relay them to the presenters within the Q&A period. And we'll go through them, hopefully go through them all at the end of the presentation. So without further ado, welcome Dr. Salami and Kemei.
Thank you so much for inviting us to present. So today, as we'll be presenting about COVID-19 disinformation, about Black Canadians. Actually, our first half of our presentation will focus just broadly on COVID-19 disinformation about Black people across the globe, based on the scoping review we did. And then the second will focus on interviews we've done on COVID-19 disinformation, specifically on Black Canadian. I and Janet are located in Treaty 6 territory, and we respectfully acknowledge that. It's a traditional gathering place for diverse Indigenous people, including the Cree, the Blackfoot, Métis, Nakota Sioux, Iroquois, Dene, Ojibwe, Saulteaux, Anishinaabe, Inuit, and many others whose histories, languages, and culture continue to influence our vibrant community. And I want you to take the time now to reflect on the land that you're located. Many of us have come here as settlers, immigrants, newcomers, either in this generation or in past generation. And I would also, as we are presenting on Black COVID-19 among Black people, acknowledge those of us that came here forcibly because of the transatlantic slave trade. And therefore, we honor and pay tribute to ancestors of African origin. As I also reflect on the land, I am very grateful for the opportunity that I've had, that have been given to me by Indigenous people to share this land with them. Next slide. So here is what we'll discuss. As I said, there's going to be two data that we're going to present. One is a scoping review we did, and based on the scoping review, we conducted interviews that is more focused on Canada, and we'll also discuss that interview that we conducted on COVID-19 among Black people in Canada. Next slide. So our research program is the Health and Immigration Practice and Policy Research Program. The goal is to address gaps in immigration and health policies and practices. And we've been engaged in around 80 funded research projects. Next slide. Goal is to train and mentor diverse talented researchers, drive high impact policy and practice, build cross-sectoral network, and shape Canadian and international policy and practice. Next slide. So we have around close to 1.2 million people in Canada that report being Black. And that was in 2016. Of course, the number has increased since then. Black people as of 2016 represent 3.5% of the Canada's total population. And the number of Black people in each city varies, from Toronto at the high end to more rural areas at the lower end. In 2020, approximately 63% of Black Canadians reported experiencing racism 5 years prior to the beginning of the pandemic or during the pandemic, compared to 32% of population of the white people. And there is evidence that does strongly suggest that racism has an impact on health outcomes. Next slide, please. So we know evidence across the globe suggests Black population are at risk of contracting and dying from COVID-19 compared to non-Black. In Toronto and Montreal, rates of COVID-19 are highly correlated with neighborhoods featuring a greater number of Black people. And neighborhoods with a higher number of Black people have a higher rate of COVID-19 infection. And this, living in a neighborhood that has a high rate of COVID-19, as a high rate of Black people, is stronger as a determinant of COVID-19 infection than any other social determinant, including education, visible minority status, income. We also know that Black people, at the start of the pandemic especially, were more likely to be affected by COVID, but they were also less likely to plan to take the COVID-19 vaccine at the start. So some of the things that contribute to underlying health and social inequities regarding COVID-19 among Black people include lack of access to quality and culturally appropriate health care, including underlying health disparities such as higher rates of HIV and AIDS, diabetes among Black population. We also know, as I said, as someone once told me, that the healthcare profession especially is like a cappuccino. It's white on top, it's Black underneath. And we know that Black people are more likely to be direct service providers, much more than white people, especially working as personal support workers. And of course, this increases the risk of contracting COVID-19. Physical environment enabled, so more access to green space. They have less access to green space, crowded housing, and also poor access to higher use of public transportation, all increases chances. And there was also early in the pandemic, at various points in the pandemic, issues related to misinformation and disinformation, which we'll be talking about today. Next slide. So we'll talk about our research on COVID-19 online disinformation and misinformation among Black Canadians. We know that approximately 96% of Canadians and 80% of Americans reported encountering COVID-19 disinformation at least on one social media site. And COVID-19 misinformation and disinformation promotes skepticism and lack of confidence in COVID-19 interventions. Black people have been disproportionately affected by COVID-19 pandemic in terms of negative impact on their livelihood, and are also more likely to be hesitant to receive the vaccine. And this information contributes to a higher rate of COVID-19. And also evidence suggests that misinformation contributes to a higher rate of COVID-19 infection in this population. So the purpose of this project was to generate evidence on COVID-19 online disinformation among Black Canadians, as well as strategies to tackle it based on available international evidence and stakeholder interviews. So our research questions what is known from existing national and international research related to COVID-19 online disinformation among Black people in the Black people. We wanted to focus on the diaspora, but because of limited data, we just focused on COVID-19 disinformation broadly. And then we focused on Canada. What is the impact of COVID-19 online disinformation for Black Canadians? And what are the perspectives of stakeholders on evidence-based practices to address COVID-19 disinformation? Next slide. So when we talk about misinformation and disinformation, there is a difference between the two. Misinformation refers to false information that is spread regardless of the intent to mislead. It is information that is inadvertently false and circulated without a clear, cynical intention. While this information is deliberately spreading inaccurate claims to deceive the public and undermine authorities, it's often amalgamated with semi-authentic news to enhance its aura of authenticity. So misinformation may or may not be done on purpose. It's oftentimes not on purpose, while disinformation is there's an intent to actually mislead. Next slide. So we used intersectionality, guided our whole project as a theoretical orientation, and we were concerned with simultaneous intersections of diverse social locations, social differences, identity, and also multiple forms of oppression. And we were also attentive to issues of power and power relations, especially across the lines of race and also other intersecting social vulnerabilities, including income and gender. Next slide. So the first we did, phase 1 was scoping review and phase 2 was interviews. So we conducted a scoping review we, with assistance of an experienced librarian, we searched several databases. And the main search concept that we were looking for was COVID-19 and other words that represent COVID-19, misinformation, and also Black people. 2 researchers independently screened articles, and a third researcher resolved conflict. In all, we had 19 studies that were included. And unfortunately, we had to expand our search because we could not get enough studies outside of Africa that actually looked at misinformation. So this was actually looking broadly at misinformation and disinformation just across the globe. We used thematic analysis to analyze qualitative data. Next slide. Next slide. So here is a Prisma diagram. We started with 881 articles from our search, and we ended up with 19 articles at the end. Next slide. So for our interviews, we did a semi-structured individual interviews with input from our advisory committee members. We had about around 5 advisory committee, 5 to 8 actually, advisory committee members who were health leaders, Black health leaders across Canada, including leaders of major Black organizations in Canada, such as the Canadian Black Physicians of Canada, that helped in terms of guiding our research. And we completed interviews with 30 stakeholders, and our stakeholders included community leaders, Black-led organization, Black health service provider. Interviews lasted around 1 hour, and it was audio recorded, and it was conducted in either English, and where we had individuals with French, we had translation service available in French. We analyzed our data using thematic analysis and with the aid of NPeople. Next slide, please. And I will pass it over to Dr. Kemei to give the findings.
Thank you, Dr. Salami. So these are the findings that we found from our scoping review. So our findings indicated that Black people are accessing, often sharing disinformation and misinformation, primarily through social media platforms such as WhatsApp, Facebook, and Twitter, YouTube, and Instagram. So we got 6 themes from this scoping review. And these are theories of origin of COVID-19, theories of transmission, prevention, and treatment of COVID-19, theories on speculation of race immunity against COVID-19, distrust in government and health organization, intervention, research, and programming, and also knowledge about misinformation in the spread through online vehicles. So I'm going to discuss these themes briefly. So for the theories on the origin of COVID-19, we found that Black communities believed so much in rumors about that COVID-19 was created as a weapon to wipe the Black population, and also that it was created to generate monetary schemes for the US and China governments mostly. And also they also believe that COVID is caused by the 5th generation technology or broadband cellular. For the theories on transmission and prevention and treatment of COVID-19, there were beliefs that of alternate treatments and methods that would prevent COVID-19, and they believe that taking herbals, such as hot teas, drinking alcohol, and constant exposure to sunlight would prevent COVID-19. There was also topics about hydrochloroquine to treat COVID-19. And also people believe that young people could not get the disease, and with older persons and those who are immunocompromised underlying illness being vulnerable to the disease. They also believe that there's test kits were infected, and so that when people were being tested, they were being infected by COVID-19. Theories on speculation on race immunity against COVID-19. Black people believe that melanin helped to prevent people against getting COVID-19. They also believe that if they went to church, they would not be infected by the virus while attending the services. And there were also beliefs that that Black people cannot be infected by the disease. But these changed after when we got data from indicating that Black people were really being disproportionately affected by the disease. So this theory was really at the beginning of the pandemic. There was also a theory on distrust in government and health organizations. So there were rumors of this misinformation about lack of confidence in the governments as well as the international public health responses. And people believe that that the governments had manufactured the disease to all the vaccine to alter the DNAs of the people, and also there were concerns about the historical experimentation of the Tuskegee for the Black people in the US. And also we found people who believe that the vaccines were developed in a hurry and could not be trusted, and also could have serious negative effects, side effects. So we also got a theme on intervention, research, and programming. So we found 3 studies, and they were all in Africa, as Dr. Salami had said. And these studies showed that if they put some interventions, that they had some interventions in place, that they were able to manage the spread of COVID virus. So for example, in Zimbabwe, they used a social media, which was they called such as WhatsApp, but I think it was WhatsApp to counter mis or disinformation among the people. So they were sending the right information to the people, and then going back again to check with the people if they were following the interventions, and they found that this process really worked well. There was also a theory on knowledge about dissemination, how disinformation is spread through online vehicles. We found that some individuals are purposely abusing social media platforms to instigate panic. In contrast, false information is sometimes spread in error without malicious intent. So mis or disinformation often occurs when people share posts created by others without vetting information. So we found that people are just forwarding information that they got in their social media. And then for the intervention, research and program, So those were the findings that we got from the scoping review. So we wanted to dig further and find qualitatively what the Black Canadians were, how the Black Canadians were perceiving COVID. So these are our preliminary findings from interviews and document analysis that we did. So we did some document analysis on Black organizations, and also we interviewed about 30 participants from Black communities. So so far we are in the process of still analyzing the data, and we found 4 preliminary themes. And these are the nature of COVID disinformation, facilitators of COVID-19 disinformation, the impact of COVID-19 disinformation on Black Canadians, and addressing COVID-19 among Black Canadians. So with this study, we've also found that the Black Canadians were also using the social media platforms as indicated in the scoping review to pass misinformation. So the nature of COVID disinformation that we found was COVID is a fallacy, that it doesn't exist. COVID vaccine has a tracking chip. Vaccine is ineffective. Vaccine contravenes faith and fake prophecies. There are also beliefs of herbal alternatives. Also beliefs of melanin as natural protection against infection, and vaccine affects fertility. So for example, these participants mentioned that whatever was circulating, trafficking is some of these ideas that like essentially the vaccine was going to be inherently harmful, and that harm was aimed specifically towards Black people. So yeah, just like things like the vaccine is going to inject people with a quasi-mind control. There were things about how, pandemic is false, or is a hoax, or is only the flu, or is a cold. I mean, occasionally I saw some 5G nonsense about how 5G towers are sometimes infiltrating things. So this shows that the disinformation that was circulating out of Canada, as per the scoping review, was also circulating within the Black communities in Canada. And then we also have facilitators of COVID-19 disinformation. So people believe that there was perception of COVID-19 as a financial gain by the pharmaceuticals and other governments. Also perception of COVID-19 as a political tool. And I think this came about specifically when they were doing about the US election, the past US elections, and also the economic profitability of disinformation. So where people were passing in disinformation so that they can get traffic in their internet and get money through it. The attitudes of the Black community also came up, and it came up mostly because of the historical encounters that they've had with the medical system. And also there was information fatigue. So for example, this person said, our community consumes a lot of online misinformation without verifying the sources of credibility. Therefore, with the absence of timely information, people will feel void with the misconception. So they were talking about how the right information did not get to the people, so they had to search their own, and they ended up finding disinformation. Impact of COVID-19, disinformation on Black Canadians. So we found that there's been increased mistrust of the vaccines due to the disinformation. People believe that the vaccine was developed in a rush and they don't think it's effective, and they are worried about the side effects. There's also impact of mental health. There's a lot of anxiety in the community about the fast evolving nature of COVID-19, and also the fear of mandatory vaccinations. So this person said, there's a lot of mental impacts on the communities. There's fear of COVID, fear of vaccines. Folks are afraid about mandatory policies on vaccines. For example, those who shave their faces so that they can fit the N95 mask. What does this mean to the SCP community? Will they be able to buy and sell, conduct businesses without the full vaccinations? People are told to take the vaccine without fully understanding the importance and the role and responsibility in the community immunity movement. And then we found that Black people did some activities and interventions to address COVID-19 disinformation among the Black Canadians. And there were so many efforts that were done by the Black organizations, Black community organizations. So for example, they had webinars, they had vaccine clinics where the Black health professionals were explaining to people about the vaccine first, gaining that trust before asking them to take the vaccines. There were also support from the government with the funding, and also people were building trust before the vaccine discussions, and that was among the Black professionals mostly. So what the people are asking for the future efforts that could be done to address future pandemics or even COVID-19, they're asking that the Black community need to be engaged in decision-making. They need to engage faith-based leaders and also Black professionals. And there was also a big call on race-based data and disaggregated data by race, and also culturally appropriate communication. They also talked about repairing the broken trust, and they asked about meaningful employment for the Black communities, and also integration of the Black people in decision-making structures, and also capacity building for the healthcare service providers. So this person says they are broken trust because of histories. Some people believe that the vaccine is a scam to depopulate the Black community and racial groups. The previous experiments on the Black people and the current Indigenous cases in Canada increased mistrust and reduced vaccine uptake. So in conclusion, there's a global paucity of literature addressing COVID-19 online disinformation among Black people. And our findings suggest a need for more qualitative data concerning Black people's experiences with online misinformation related to COVID-19. And there's also a need for race-based data in Canada and a collaborative approach in addressing community concerns. Thank you so much. I just want to acknowledge that this project is funded by the Government of Canada Department of Heritage Digital Citizenship Program.
Thank you so much, Dr. Salami and Dr. Kemei, for such a thorough presentation. We have about a couple minutes for questions, so we'll get right into them. So just pull them up. Our first question here is, what strategies have policymakers implemented to reduce dis and misinformation and alleviate vaccine hesitancy among Black Canadians? And do you have any other suggestions? So whoever wants to start with that one.
I'll start with it. I know this because I am the co-chair of the Black Task Force of Black Opportunity Fund, of the Task Force of Black Opportunity Fund, and a lot of Black organizations are involved in that. And I know the federal government did engage Black community organizations, including, I think, Federation of Black Canadians or Foundation for Black Canadians, one of the two, or maybe both, and also Black Opportunity Fund, to engage the community in terms of disseminating information, correct information. So for example, organizing town halls. There were videos created by Black Opportunity Fund targeting Francophone Black people to address COVID-19 disinformation. I think in terms of what more needs to be done, I mean, we've learned lessons from this, and I think what needs to be done more is trust within the Black community, and also capitalizing on the strength we have. So an emerging strength we have due to the movement is the increase and rise of Black health organizations across Canada. And I think we need to capitalize on this and see how we can draw on the potential of Black health organizations to actually lead the efforts. But we also have to be careful, of taxing organizations or putting a lot of work on organizations without actually providing them with the resources or compensation for the work that they do.
Dr. Kemei, would you like to add anything to that?
I think Dr. Salami has said it all. It's mostly trying to engage the Black community and providing them with the resources for them to be able to help the people.
Perfect, thanks so much. And then the next question here is just very general. What are your timelines like for analyzing the interview data? And also here, has perhaps the scoping review been published?
Dr. Kemei, can you remind me about the scoping review where we are at?
Yes, so we have submitted the scoping review, and they have sent it back to us with minor revisions to be done. So we should be sending it back sometime this week, and we are hoping that it's going to be published. And for the analysis, so the data collection and analysis is we are doing it together. I can say that word, iterative, yeah. And so we are analyzing and we are coding at the same time. So, and we are hoping to be done soon, actually. In the next couple of weeks, we should be done.
Sounds great. Dr. Thanks so much.
Can you remind us what journal we submitted to?
For the scoping review?
Yes.
I forget. It's international. It's Journal of Global Health. Sorry, we've submitted a lot of papers. Journal of Global Health.
Thanks so much.
Yeah.
So we'll move on to the next question. What was the social media-based counseling approach that was used for the quasi-experimental study?
For the wait a minute, let me just look real quick. We're talking about the African countries, right?
I think so, that makes sense, yeah.
Yeah.
Sorry.
Dr. Kemei, if you need some time to look.
I can send that to you, sorry.
You can just write it in the chat too, that's fine.
Okay, perfect, yeah.
Thank you. So we'll move on to the next question here is, do you have any key messages for healthcare providers addressing COVID-19 disinformation or vaccine hesitancy among Black Canadians?
I can answer that. I think, the main thing, there was another survey that was done that I was involved in by Black Opportunity Fund in collaboration with